Good afternoon, everyone. I welcome you all for the Friday webinar on pregnancies. I'm Dr. Preeti Jindal, Director of the Touch Clinic, Mohali. It's an advanced gynae and obstetric center, and we look after high-risk pregnancies. So, in our these series of webinars, we are trying to educate our pregnant, going to be moms and their husbands about what to look forward to and how to carry on with this journey. Today in our series, we are going to discuss the role of father, how to plan your finances, hospital bag checklist, emotional and physical changes post-delivery. So a baby is formed both by mommy and daddy. The role of father is something which is very, very crucial, but somehow in our culture, in our society, it's given a very backstage. And many times, the going to be dads, they feel very left out in the pregnancy. At the Touch Clinic, we always try that in most of the consultations, the dads are there and they know what exactly is happening. Apart from that, there are some very specific roles which going to be dad has to do to look after the wife and your baby. This is a very, very joyous moment. You are going to be a dad, and it is equally exciting as it is for a mom, that feeling, that special role which you are going to take in your life. And it also comes with lots of responsibilities. So it is very, very important that you are always there, if possible, during your consultations of your wife with the doctor. You are equally involved in the care of the pregnancy and you are emotionally supporting your wife. Life becomes easier for the baby and the wife if you are already involved in it. Why involvement in all three trimesters of pregnancy is important for all those dads who do not know. The pregnancy is divided into three trimesters. First trimester, which is till 12 weeks, then second trimester, which is from 12 to 28 weeks, and third trimester, which is from 28 weeks till delivery. Now, in first trimester, it is very important that you should come because you see for the first time on the ultrasound how from a dot your baby is growing. Secondly, when you see the heartbeat for the first time, it is very joyous moment. You see something of your own creation with a beating heart. It is a feeling which is very difficult to describe. In fact, it cannot be described. It can be just felt. So do not miss on that moment. Then in the first trimester, the woman is going through lots of changes. You have to imagine that she is also a young girl like you. And this is the first time, or maybe second time or third time she is being pregnant. And pregnancy brings lots of emotional and physical changes in the body. It's very difficult to cope up with the nausea, with the vomiting, with the changes in your physical appearance. You do not feel good. You feel very lethargic. You feel like sleeping. And at times, you may not feel like doing anything which you normally would have done, like going to the parties, going for shopping, or looking after the relatives. You may just want to be on your own. So husband has to understand that the wife is going through all these changes and should be there to provide the support. Many times it happens that the couples, they say that, ma'am, we were planning to go for a movie and at the right time my wife said that she doesn't feel like going. It's absolutely normal because the woman is going through so many changes that she may just not feel like going, and you have to understand it. And this will go, it will pass by. These emotional changes, these tantrums which you may feel your wife is throwing, it's not in her control. She may suddenly become very angry and she may suddenly become very upset. Then in time she may be very happy. So you have to understand that she's going through lots of changes and you're just understanding it makes it easier for her. Then after 12 weeks, nausea and vomiting settles down a lot. She is more up to going out and eating everything. And then it's one of the best times of the pregnancy. After 20 weeks, most of the babies are able to respond. You start feeling the movement. So if you put the hand on your wife's tummy and you may feel the baby's movement. Also, If you talk to the baby, you start talking to the child, and the baby is able to hear your voice. So we tell the couples that you start talking to them after 22, 23 weeks in the night, sing a nursery rhyme, or just talk to your child, and the baby will be able to identify your voice once the baby is born. They start learning the language. We all know about Abhimanyu's story, and they are not they are mythical stories, but then there is a bit of truth in it because the babies are known to hear the sounds in the womb. Also, there are lots of researches which have shown that if the babies are agitated, then if the soothing voice of mother and father makes them calm down. Another study which has shown is that if the couples are fighting or screaming or they're in the very loud noise area, the baby is able to hear that and baby too gets frightened. So it's very important that you should not talk very loudly when your wife is expecting, and you are tolerant and you do not get angry, because the anger voices, they have been found to make the baby scared. Also, reading is very good to the child. Even the baby is not born, but baby can hear. You can learn more about it from the book My Little Pregnancy Companion, which I have written, and there is a lot about what all can be done at what trimester. So, what other supports can be given by a father? Do not argue with her for first 3 months at least. And in fact, you should not argue, but then sometimes the situations are not avoidable but one should try to understand. Be available during antenatal visits and scan, and get connected with a new life which you have created. On ultrasounds, you can see baby's face, hands, and feet. After 12 weeks, baby's organs are formed. And actually, on the scan, you can see the baby's face, the hands, baby waves to you. And you can even talk to your child. You can discuss the name and make a birth plan with your wife. Now, some very important thing which I feel that should be a concern of the dad and not of the going to be mom is the finances. Medical care is definitely becoming expensive. So you have to plan in advance that how you're going to meet the finances of the delivery. Ideally, the delivery should take place in a hospital with all the facilities for mother and the baby, because it is the matter of two lives. So you should check out your insurances. If there are any insurances, go and talk to your obstetrician doctor of your wife, that what which all hospitals she delivers the moms, and whether those insurances are valid or not. If you do not have insurances, try saving the money bit by bit. You have 9 months to save the money, and it's not very huge amount, so you can start saving that money so that the wife does not have to bother about that who's going to pay for her delivery, and sort out the place of delivery much in advance. You can help your wife in preparing the hospital bag checklist, because you have to remember at the time of labor, it's you who has to run. She cannot do anything. So it's better that you make your hospital bags ready beforehand, arrange for adequate help. And at the time of labor, who all will be there in the hospital? Nowadays, as you know, COVID is going on, so most of the hospitals do not allow too many chaperones. And especially if it's a good hospital, they will ask you to get your COVID test done also if you have to be with the wife. So you plan all those things in advance. And also important is that you should be available during antenatal exercise sessions. Dutch Clinic organizes lots of sessions, and if you will go onto the webinar on our website, you will see antenatal exercises also. Do them with your wife every day so that she does not feel alone, she feel a companionship, and also she is healthy, and it also increases the chance of vaginal delivery. What all to be checked in the financial checklist? You have to check, you have to know the pre-pregnancy cost for every trimester till the actual delivery. Increase the emergency savings from 3 months to 6 months. Create new household budget with new expenses that a child brings. Sit down and with the spouse to discuss changing in spending pre and post baby. Have adequate health insurance cover. If you have pregnancy covered in health insurance, do call the insurer to verify coverage for delivery and post delivery expenses. Review and increase your health and life insurance cover. Plan for things that you need to buy with the arrival of the child. A child is a complete new individual with all the costs attached, so you have to plan it. Do keep aside money for any religious ceremonies that are essential, and also where the vaccination and the child care will be taking place. So, congratulations, you're going to have a baby, and it, along with this excitement, it also brings a lot of responsibility, which you should be ready to share with your wife and should do it because the baby belongs to both of you. So many congratulations. And now I invite Dr. Cherry, who's consultant with me in the Touch Clinic, to carry on with the other aspects. Thank you.
Hello everyone. Again, continuing with the topic, uh, since financial planning is very important, so you must be worrying about your future and your child's future. So financial planning is very important as it ensures that your family is taken care of after the birth. Now, what can we do? You must be wondering what can I do with the financial planning when we as a woman are pregnant, or if the husbands are seeing, then how I can take care of everything. So what do's are there? So what first of all you can do is you can meet a financial planner and discuss your goals about how the future you have to manage your finances, and plus you can save some part of your salary into your maybe a salary account, or maybe you can develop some another account so that those expenses can be used when the baby is born. Then you have to plan your budget accordingly, and also you have to change your preferences. You have to plan whether you need a big car, home, are they important, are these expenses right now, since your wife is pregnant, or as a lady we are pregnant. So are these important more than maybe we can save that little amount of your salary for the future delivery of the baby, and invest. Purchase a life insurance policy, and you can save that thing for your child's future. Now, what are the don'ts, which is more important? So, don't think that you can do it all alone. So this is a busy time. Making it important to get help is definitely important. Expect the life to stay the same. So don't expect the life to stay the same. So same as your financial expenses. Don't stress out for this thing. You can tackle this. Take a deep breath and stay calm. Don't make rush decisions. So don't slow down and plan for the best results. And don't forget emergencies. They are definitely bound to happen in life. So create definitely a nest to protect your family. So we are at Touch Clinic pleased to help you. So this is a leaflet which I am showing you, where the Touch Clinic definitely helps you with the financial planning and the health care. As the number given of Mr. Sanjeev Kumar, you can contact the person and discuss about your future plans, and or you can come at the Touch Clinic counter and you can have more detailed discussion about it. Definitely the patients who are getting uh, their life insurance or maybe their health insurance being done through the Touch Clinic, they are getting the special discount. Now, the exciting thing is the hospital bank checklist. So ever since the couple comes to us and asks us, okay, like what should we pack in our bag when we come back, when we come to the hospital for the delivery? So here are the checklist for we can prepare out. First is the clothes which a women should be carrying along with them, with which they should have the front opening for the breastfeeding, the dressing gown, slippers, nursing bags, breast pads, maternity towels, pants, toiletries, and the towels. Now, what to pack in your hospital bag? Again, the continue could be the makeup, definitely. You should carry it with that. So after delivery of the babies, you can have nice collect their photographs with the little one, and always there will be a sweet memory of yours. Then the tissues, money for the phone, baby announcement cards, pen stamps, the outdoor clothes, baby clothes, nappies, baby toiletries, shawl, blanket, and the mitten if it's cold. So what is the labor bag? So in the labor bag, what you should carry is the natural sponge or the face cloth, oil or the lotion, loose t-shirt, socks, hairbrush, and your clothes with an in front opening, and the inner suit should be used after birth. Along with that, again, the towel, toiletries and the tissues, snacks and drink. Or you can always bring the personal stereo for relaxation, the camera, money, or the phone card. Now, coming to the emotional and the physical changes post-delivery, it's again one of the important aspects which we women maybe we just ignore them or we think it's normal. So for that, you first have to know what is the postpartum period. It is the interval between the birth of the newborn and the return of the reproductive organs to the normal non-pregnant state. So in a nutshell, it is that interval in which a body comes back to a pre-pregnancy. So it lasts for 6 weeks with some variations among the women. What you expect your body after birth? You could be the belly button, a different shape what it was before pregnancy. You may have night sweats, or maybe there is some reflection on the labor and the birth, a saggy tummy, or maybe you are feeling tired but unable to sleep. After pains, especially when breastfeeding, the dripping breast, excessive thirst, especially when breastfeeding, or burning sensation while passing urine, loss of vaginal tone, or running to the toilet to wee, and the numbness in the perineal area. So how can we deal with all this thing? So again, in detail explaining, in the general physiological changes, there could be an immediately following delivery, you may feel a physical fatigue, and the temperature, it may be slightly elevated later on due to milk engorgement and the urinary tract infection. So mind it, while you are breastfeeding the kid, you have to keep palpating your breast to see that there is no lump formation in the breast. And if it is there, do inform the doctor. Or after delivery, you really have to drink a lot of water so that the the ureter and the bladder, they get flushed out with frequent urination, and you avoid that urinary tract infection. Then excessive sweating, which ceases within the first week after delivery, and the skin pigmentation, it lightens gradually. So you don't have to worry, but make sure you continue applying the sunscreen over your skin at least twice a day to prevent further pigmentation. Now the urine output, normally the ladies, they have physiological diuresis. So what do you mean by diuresis? That is, you have to go to washroom again and again. That is physiological, so nothing to worry about that thing. But some ladies, they may have urine retention. Why so? Because it is laxity of the abdominal muscles. That abdominal muscles, they relax, they don't tend to contract. Or it is atony of the bladder. That is, the bladder, it doesn't get contracted when it is full. Or there is reflex inhibition due to stitched perineum. If somebody have a vaginal delivery or the cesarean, they might not be able to pass the urine because of the reflex inhibition. And there may be thirst present due to the marked fluid loss through the sweat and urine. So ladies, please keep yourself hydrated. And how the bowel functions, they get affected. You may have constipation, which may be due to intestinal atony. Again, the intestines, they become relaxed. Or there is loss of body fluids, and there is laxity of the abdominal muscles. Then the abdominal muscles, they get relaxed out. What about the body weight, which we are worried almost every time? So the good news is the 4 to 5 kg of the weight loss is there, which happens during the first 10 days. This could be because of diuresis and evacuation of the body contents. Now, one of the important factors which the ladies normally experience is the uterine after pains. So what do you mean by that? So uterine after pains is basically a spasmodic colicky uterine contractions which are following delivery. They occur in almost all the women, which increases during the breastfeeding. They are more painful in the women with over-distended uterus. That is, if you're having twin of the liquor around your baby is more, or you have a big fat baby, then definitely you will tend to have that experience more of uterine after pains. But nothing to worry. They diminishes in or they go away within the first week post-delivery. Now, what are the postpartum blues? Now, sometimes after delivery, you may be feeling that you are happy in 1 minute and then sad in next minute. What is happening to you? So then you wonder, is this the baby blues? So you might be experiencing that you are anxious, or sometimes you are sad, irritability may be there, or you may feel yourself as lonely, or you may have a feeling of that you want to cry all the day. Or there could be headaches, exhaustion, a sense of inadequacy, and maybe a mild depression also. So the thing is, if you feel better after a week or so, then you just had those baby blues. And if it takes longer to feel better, that is more than 2 weeks, then you might be suffering from the postpartum depression. So what is the difference between the baby blues and the postpartum depression? So in the prevalence, 70 to 80% of the women they will have baby blues, while only 10% will progress to postpartum depression. Now the baby blues onset is 3rd to 4th day post-delivery and it lasts normally for 2 weeks. While the postpartum depression, the onset could be any time and it lasts more than 2 weeks. For the severity, baby blues, they have mild dysfunction in the regular activities from day to day which we are doing. With the postpartum depression, the severity could be moderate to severe dysfunction of the normal day-to-day routine activities. While in the suicidal tendencies, that is very important. So in baby blues, you won't have a suicidal tendency, while in the postpartum depression, definitely if it is prolonged, you may have the suicidal tendency. So what is the, just summarizing the thing, the difference between the both of the thing of the postpartum baby blues and the postpartum depression is postpartum baby blues, the onset is 3rd to 4th day of delivery and it normally lasts within 2 weeks, while the postpartum depression, the onset could be any time after delivery and the symptoms they persist for more than 2 weeks. Now, why the postpartum education is necessary? Why we are conducting this webinar? Why? Because in the postpartum education, normally the women thinks that this is a normal thing, having mild baby blues or depression, and they do not seek the medical advice. They may have difficulty in fulfilling the need of their kid and must be aware of these symptoms. So what self-help you can do to prevent these? So make a healthy lifestyle choices. That is, rest as much as you can, exercise regularly, eat healthy, and avoid alcohol. Why? Set realistic expectations. Don't pressure yourself to do everything. Do what you can and leave the rest. Ask for help if you need it. Make time for yourself. This is very important, which we tend to ignore. So take some time for yourself, talk to your friends, and spend some time alone with your partner. Avoid isolation. Talk with your partner, family, and the friends about how you are feeling. Ask other mothers about their experiences and consult your doctor if need be. So now, after doing all the self-help, if like at what point you should seek a help from a doctor? You must consult your doctor if experiencing previously mentioned signs or symptoms which do not fade after 2 weeks, or there is worsening of the symptoms, interfering with the caring of the baby, and interfering with the daily activities. Definitely, we require help, ask for help if need be. Now, one of the important questions which normally a couple ask is the return of menstruation. So, in the return of menstruation, if you are not nursing, the return could be within 6 to 8 weeks, while in the lactating mothers who are breastfeeding their child, the return could be 2 to 18 months postpartum. What about the ovulation? As early as 5 to 6 weeks after delivery, and delayed resumption is due to the breastfeeding. But Keep it in mind that ovulation can commence in absence of menstruation also, and another pregnancy can occur. So contraception is advisable post-delivery even in the absence of menstruation. So it's always advisable, since ovulation can occur even in absence of menstruation. And ladies, you can get pregnant even if you don't get menses. So maybe after 2 to 3 months post-delivery, you should consult your doctor for the contraceptive advice. Resumption of the sexual intercourse. It is safely assumed when bleeding or the lochia has ceased or stopped, episiotomy healed, and a woman feels ready for it or comfortable. So usually it takes 2 to 6 weeks. Now, what is the first? You have to keep it in mind that the first intercourse may be uncomfortable due to partially attributed to the vaginal dryness, or there may be diminished vaginal lubrication, but nothing to worry about. So what are the concluding sentence? Now, the take home message is that the role of a father should involve in all the three trimesters and see what is happening, how the baby is growing, and get attached to it. Plan your finances, a must have for a long way run. Hospital bag checklist any rush and confusion. And for the emotional and physical changes post delivery, just a rough guide. So after 6 weeks, if somebody is having the vaginal delivery, the uterus will be back to pre-pregnancy size by 6 weeks. Bleeding will stop, though can temporarily restart again. And most people are cleared for the sexual activity or the exercise. And those with the cesarean section, uterus again comes back to the pre-pregnancy size. Sexual activity and exercise are also okay to do, but exercise you should start slowly. They are clear to try and lift something other than the baby, and scar might feel numb or itchy. What about the mental health status after 6 weeks? They will feel exhausted and may sometimes become overwhelmed, which is normal, and deeper feelings of depression, hopelessness, or anxiety should be discussed with your doctor. Now, what about 6 months? Post delivery, your hair should stop falling out, full bladder control should return, milk might be drying up, and period may come back at this time for the person who had delivered vaginally. For the cesarean section, potential to be more tired at this point, milk might be drying up, and period may also come back. What about the mental status? Mental status is potentially more positive at this point, and lingering signs of postpartum depression should be discussed with your doctor. So finally, just summarizing, a baby fills a place in your heart that you never knew it was empty. And pregnancy, enjoy every single moment of it. Thank you. Now I'll invite Ms. Anchal to continue with the further webinar series.
Thank you so much, ma'am. Now I ending up the session by telling you some information about the clinic services. Just a minute. Yeah. So as you all know that we take all precautions for COVID-19 at our clinic, consultation with prior appointments only. COVID testing is done prior to delivery or any surgery.
Anchal,
Yes.
sorry, your PPT is not visible.
Just a minute. Now it is visible?
Not yet.
Now?
I can see your screen. Yes, it's coming now. Yeah, fine.
Okay. So once again, I'm telling this same information again and again in all webinars that we take all precautions for COVID-19 consultation with prior appointments only. COVID testing is done prior to delivery or any surgery. We take care of all the safety parameters in our clinic. We have a pharmacy, as you all know that we have a pharmacy, home delivery of medicines available at your doorstep. By that, for that you have to call on the number 0172 5032 467. एंड 9613112000। ये बोथ नंबर्स हैं, आप इन पे कॉल करके जो है मेडिसिन अपने डोर स्टेप्स पे मंगवा सकते हैं। We have a touch lab also, avail home blood sample collection facility. For that, you have to call on the number 99154 96821 and 99157 48821. Both numbers are for the होम ब्लड सैंपल कलेक्शन। इस पे कॉल करके आप जो है हमारे एग्जीक्यूटिव को अपने घर पे जो है वो बुला सकते हैं फॉर द ब्लड सैंपल कलेक्शन के लिए। एंड द लास्ट वन इज जैसे कि डॉक्टर प्रीति जिंदल से कोई अपॉइंटमेंट लेना चाहता है, वी हैव 3 मोड्स ऑफ अपॉइंटमेंट्स। फर्स्ट इज वीडियो कंसल्टेशन, सेकंड इज फोन कंसल्टेशन, थर्ड कोई जो है फिजिकली आके मिलना चाहता है क्लिनिक पे। For the video consultation and the phone consultation, you have to book your slot by calling on the number 99157 48821 and 9888448803। आप इन बोथ नंबर्स में से किसी भी नंबर पे कॉल करके अपनी बुकिंग जो है वो बुक करवा सकते हैं डॉक्टर प्रीति जिंदल के साथ फॉर द वीडियो कंसल्टेशन एंड फोन कंसल्टेशन। अगर कोई विजिट करना चाहता है वो हमारे क्लिनिक में विजिट भी कर सकता है। हमारा जो एड्रेस है वो है द बेस्टेक बिजनेस टावर्स A5A8 सेक्टर 66 मोहाली में। मैंने पहले भी बताया है, हमने जो है एक सर्विस शुरू करी थी, होम केयर सर्विस फॉर माइल्ड कोविड पेशेंट कि हर पेशेंट को जो अगर थोड़े से भी सिम्टम्स होते हैं कोविड के, उनको एडमिशन की कोई रिक्वायरमेंट नहीं होती है हॉस्पिटलाइजेशन के लिए। वो घर पे रह के भी मतलब घर पे रह के भी वो जो है कोविड जो है वो अपना ठीक कर सकते हैं। बट उसमें आपको जो है डॉक्टर के साथ जो है इन टच रहना पड़ेगा। वैसे उसी के लिए हमने 10 डेज का पैक निकाला है, होम केयर 10 डेज प्लान, जिसमें आपको जो है हमारे डॉक्टर है वो डेली कॉल करेंगे, टेली कंसल्टेशन होगी हमारे डॉक्टर के साथ। और हमारी जो नर्स है, स्टाफ नर्स है, ट्रेन स्टाफ नर्स, वो आपको ट्वाइस अ डे कॉल करके आपकी डेली मॉनिटरिंग करेंगे, आपके सिम्टम्स वाइटल्स वगैरह लेंगे और वो रिकॉर्ड रखेंगे फॉर 10 डेज। और उसमें जो भी आपको एंटीबायोटिक्स चाहिए, जो भी मेडिसिन चाहिए, वो सारी हमारे जो डॉक्टर है वो आपको प्रिस्क्राइब करेंगे। और उसमें जो भी आपको ब्लड सैंपल कलेक्शन करवाना है या होम डिलीवरी ऑफ मेडिसिन चाहिए होगी उस टाइम पे, वो भी हम आपको जो है अवेलेबल करवाएंगे आपके घर पे। और जो लैब कॉस्ट होगी और मेडिसिन की जो कॉस्ट होगी दैट विल बी एक्स्ट्रा, मतलब ऑन एक्चुअल रहेगा वो। और आइसोलेशन किट चाहिए होगी आपको, जिसके अंदर थर्मामीटर, पीपी किट, सैनिटाइजर्स, तो जो भी रिलेटेड मास्क होते हैं, ग्लव्स है ना, जो भी स्पेरोमीटर, जो भी उस आइसोलेशन किट के लिए आपको रिक्वायरमेंट होगा घर पे स्टे करने के लिए, वो भी हम प्रोवाइड करवाते हैं। तो इसकी इंफॉर्मेशन अगर किसी को लेना है तो उसके लिए आपको कॉल करना होगा 99157 48821 पे या 0172503247। सो जैसे कि हम एवरी फ्राइडे एंड एवरी ट्यूसडे वेबिनार्स करते हैं। तो ये हमारी वेबिनार सीरीज है जो भी स्क्रीन पे आ रही है। एवरी फ्राइडे जो हमारा होता है दैट इज रिलेटेड टू द प्रेगनेंसी, एंड जो हमारे एवरी ट्यूसडे होते हैं दैट इज रिलेटेड टू इनफर्टिलिटी। तो जो हमारा नेक्स्ट वेबिनार होगा वो इनफर्टिलिटी के ऊपर होगा। जो हमारा इनफर्टिलिटी के ऊपर होगा वो हमारा वेबिनार है जो अभी अपकमिंग ट्यूसडे को आएगा, डाइट एंड वेज टू इम्प्रूव योर फर्टिलिटी एंड मिथ बस्टर्स फॉर एनहांसिंग योर फर्टिलिटी। तो ये आप मिस मत करिएगा, बहुत ही इंपॉर्टेंट टॉपिक है इसके बारे में। तो हमारे जो टाइमिंग्स रहेंगे, सेम टाइमिंग्स है 3 to 4 PM और ट्यूसडे एंड फ्राइडे। अगर फिर भी किसी ने मिस कर दिया है वेबिनार या कोई और वेबिनार लाइक बीच में किसी ने लॉगिन किया है, वो हमारी वेबसाइट पे जा सकता है। हमारी वेबसाइट स्क्रीन पे आ रही है www.thetouchclinic.com। आप इस वेबसाइट पे जाके हमारे जितने भी अभी तक के रिलेटेड वेबिनार्स हैं आप सुन सकते हैं। और फिर भी किसी को कुछ प्रॉब्लम आता है तो वो हमारे नंबर्स पे कॉल करके इंफॉर्मेशन ले सकते हैं। मैं नंबर दोबारा रिपीट कर रही हूँ 99157 48821 पे या 9888448803 पे। आप इन पे कॉल्स करके इंफॉर्मेशन ले सकते हैं। और जैसे कि आप सीरीज देख रहे होंगे वो ट्यूसडे की सीरीज थी, एंड दिस इज फॉर द फ्राइडे वेबिनार सीरीज जो रिलेटेड टू प्रेगनेंसी है। तो नेक्स्ट जो हमारा टॉपिक रहेगा नेक्स्ट फ्राइडे वो है मिथ्स एंड फैक्ट्स ऑफ ब्रेस्ट फीडिंग एंड कॉन्ट्रासेप्शन मेथड्स फॉर लैक्टिंग मदर्स के लिए। तो ये जो हमारे टॉपिक्स हैं, आप अगर आप हमारी सीरीज देख रहे होंगे तो सिर्फ अब 2 टॉपिक्स ही जो है वो रह चुके हैं। लाइक 27 नवंबर को हमारा लास्ट जो सेकेंड लास्ट टॉपिक है, एंड आफ्टर दैट 4 दिसंबर को हमारा जो लास्ट टॉपिक रहेगा। तो मैं रिक्वेस्ट करती हूँ सबको कि अगर किसी ने कोई टॉपिक के बारे में चाहते हैं कि हम उस टॉपिक के बारे में आपको एक्सप्लेन करें, या हम आपको वो टॉपिक हमने नहीं कवर किया है, या ऐसा कोई टॉपिक हो जो आप चाहते हो कि हम उसके बारे में आपको स्टडी करवाएं हमारे डॉक्टर प्रीति जिंदल और उनके साथ एक स्पीकर, तो आप प्लीज हमें मेल कर सकते हैं या फोन पे इन्फॉर्म कर सकते हैं, सो दैट हम उस टॉपिक को नेक्स्ट 4 दिसंबर के बाद जो नेक्स्ट फ्राइडे आएगा, हम उस पे उसको जो है उस दिन के लिए बुक कर ले। तो आप नंबर्स स्क्रीन पे आ रहे हैं, मैं दोबारा रिपीट कर देती हूँ, 9915748821 पे, या हमारे ईमेल आईडी है touchclinic11@gmail.com। आप उस पर भी शेयर कर सकते हैं कि अगर कोई टॉपिक हमने मिस कर दिया है या आप चाहते हैं कि हम इस टॉपिक के बारे में आपको स्टडी करवाए, तो आप प्लीज मेंशन करिएगा, ठीक है। सो नाउ एंडिंग द सेशन, थैंक यू सो मच फॉर पेशेंट हियरिंग। अब आपको हम मिलेंगे नेक्स्ट ट्यूसडे। थैंक यू।